Good afternoon. This is Lynette Elliott. Thank you all for joining us today. It's been a while, hasn't it? Happy New Year to everyone. We are here today for our new year reorientation. This is the first Gravity meeting of 2020, and we will start with our usual administrative items. For those of you who have not joined us before now, we zip through some admin items very quickly, and then we will share our agenda and kick off the call. We have a lot to cover today, so hopefully you've all had your coffee and are ready to fasten your seatbelts because we're going to fly. If you would like to pose questions or comments during the call, please use your chat feature. We monitor this throughout the call and we will address your questions and comments as they come up if we are able, if time allows. You are also all coming in on mute because we do record these calls and we post them on our Confluence following the meetings. When we open up for questions and answer sessions, you can unmute yourselves. If you're on a mobile device, you can press, I believe it's *66 to unmute yourself. Next slide, please. If you have not already done so, please do join the Gravity Project on our Confluence. You can be an other interested party or a committed member, and we welcome participants of all levels. Whatever that means to you, we welcome you, and we welcome your input and your feedback. Next slide, please. We also want to express our deep gratitude to our project founders and our in-kind support sponsors. We could not do this work without these organizations supporting us financially, and we appreciate every single one of these teams who have been so kind and so generous with supporting the Gravity Project. And if you are interested in being a sponsor as well, next slide please, you can email our colleague Henry Alphen at gravityproject@emiadvisors.net, or you can visit our Confluence page and there's a button there where you can click on it to express your interest in being a Gravity sponsor. Next slide, please. This is our agenda. As you can see, we have a lot to cover. We will go through our project roadmap and upcoming schedule, and then we will share with you the consensus voting and dispositions results from late last year. We will go through coding gap analysis updates. We're working on a lot of things behind the scenes that we haven't been able to share with the community until today, so we're happy to do that. We will go through some data, Gravity data principles, and then we will go through housing instability and homelessness, which is our next work domain, and Sarah will walk you through how to submit data elements for that and our process for adjudicating those. And then we will go through some Gravity governance. We are standing up a technical advisory committee, and we are going to ask all of you to consider joining that as a participant or recommending someone as a participant. And then we will assign some homework. Don't worry, there won't be any pop quizzes. And then we'll go through next steps, and we will let you all go at 5 p.m. Eastern. Next slide, please. This is our team. This is the EMI team on the left, Evelyn Gallego, who is our program manager, myself, Lynette Elliott, I'm the project manager, Linda Hyde, who is our coding terminology expert, and she leads the adjudication of the data element submissions, and she'll be speaking to you about that later. Sarah DeSilvia is our fearless social determinants of health clinical informatics lead. That's quite a title, say that fast. Mark Savage is also helping us with social determinants of health data policies. He's our lead for that. And then Lisa Nelson, who was just at HIMSS in Australia, is unfortunately not able to join us today probably, but she is our technical director, and she's the one who handles all of the Fire IG work and the technical teams. Next slide, please. We will be at HIMSS 2020 in Orlando in March, and you can find us at these presentations, and this is also on our Confluence, and we will send out a follow-up email to all of our registered members probably early next week that includes links to all of these things that you see in this deck. And we will post this deck on Confluence as well in our past meetings page. Next slide, please.
My apologies, Lynette.
Oops.
I can't get
no worries.
Yeah, I can't get here we go. Sorry.
Okay.
Now it's my turn.
That's okay. And I will hand it off to Evelyn at this point. Go ahead.
Sorry, that was quite an intro. Thank you so much, Lynette, and good afternoon, everyone. We are so grateful for the opportunity to meet with you all again and be able to give you an update on where we are going with the Gravity project. So what you see in front of you is a very busy slide of our updated timeline for the next 2 years. Well, a year and a half, I would say, because we only go into Q2 2021. But this is just to emphasize our work that has been completed to date. For those just joining us and not familiar with our project, we always align with our overall overarching timeline, which consists, of our 2 streams of work, which is domain, SDOH, social determinants of health domain, and the fire IG work. So this is really to highlight those 2 main streams and acknowledge what we've done and where we're going. So for those, again, who just joined us, who were not participating when we launched in May of last year, incredible how much we have accomplished in almost a year. We worked on our project charter, and then we worked on use cases that were defined, the data exchange for social determinants of health documented in clinical settings. Then we moved on to food insecurity, and we completed that. So we'll talk about, the results of that in the coming slides. And what you will also hear is that we are now gearing up to standing up our 2nd domain, housing instability. We will kick that off in March and go through the same process. And then we will move on to our goal is to stand up transportation in August. However, we also have the request to our community at large that not only send us housing data elements, also send us transportation if you have those available. However, we work on this sequentially, so we won't start adjudicating those until we've completed the housing data elements. And for each one, so I do want to highlight, because this will, Linda will speak more about what we're doing right now with food insecurity. Once we identify the data sets and they're published, we of course then identify what are the gaps, the coding gaps, meaning what codes are applicable to represent the concepts and what's missing. So we're in that process right now for food insecurity, and Linda will talk more about it. And so for each one of these, we have the same task. So that's why they're labeled 3A, 4A, 3B, 4B. So they, it's a B, A and B set. So, and now I just realized we need to update this one. So what that then informs is the fire implementation guide. So as Lynette noted, Lisa Nelson is our technical director and is leading that effort with the technical team. She started the Fire IG in October of last year. We are geared and on target to develop that and ballot it in September of this year. That means we have to go through a series of 3 testing events. She just completed one. They participated in the HL7 Connectathon in Sydney. And when she returns back from leave, she'll be able to give this community an update on it. And what she's gearing up now is for the May Connectathon, we will have a gravity track. So just acknowledging to everyone who's listening, if you are interested in that, on our website, Confluence, there are links to sign up for the Connectathon, but that's our next goal. We will also have a September Connectathon, but we will use the results of the February and the May testing events. We may do another one in between to inform what gets valid. All right, so I'll move on to the next slide. I'm hearing some background noise. So what is our timeline? Again, for those who have joined us before, you're used to seeing us map out what we plan to do on a week-by-week basis. Our goal this year is not to host as many public meetings. We know it's difficult for, you're all volunteer listening to us, contributing. We really have an aggressive schedule with these 2 domains. So we want to do as much as we can in the background, and you'll soon learn how we want to leverage a technical advisory committee for that purpose. So now moving forward, you'll notice that we intend to kick off the housing instability domain on March 19th. We will do this right after HIMSS, because as you've seen in the previous slides, we will be busy at HIMSS. So we'll launch when we come back, and then we will hold bi-weekly meetings. So this is our schedule for bi-weekly to target end-to-end review by the end of May. So by the end of May, we would hope to have a comprehensive housing data set and be able to start looking at the coding gaps. To support this very aggressive schedule, we're asking you all, and you'll see this as part of the homework, to please submit your housing data concepts by April 3rd. So today we're telling you it's February 13th. We hope that if you want us to review and adjudicate your housing data concepts, please do send them to us by April 3rd, and Sarah will talk more about the process in the coming slides. So with that, before I jump off into coding, any questions from the community? All right, if no questions, I'll hand it over to Sarah.
Hi, everyone. Welcome back. We've missed you. This is Sarah DeSilvi. As you remember, I was on the project as a food and security subject matter expert. I'm continuing on with the project to assist with the project on an ongoing basis from the social determinants of health clinical informatics perspective, which is my little odd spot that I occupy. So we're going to take some time now and discuss the consensus voting results. So as you know, we spent December in our consensus review, and then even though we haven't been doing public work, we've been doing lots of background work to reconcile those consensus comments. So we received votes from over 50% of committed members on the food and security master data set, and we really want to say thank you. Total votes were 108. Yeses without any comments were 67. Yes with comments were 19. There were no formal objections, and then 22 committed members abstained. All comments were reconciled and assigned one of the following dispositions, either an acknowledgement, which is essentially yes, noted, or accepted. And what that meant was that some reconciliation between the comment and the existing data set was required. And then the subject matter experts worked with the submitter to reconcile that, and then considered but not accepted, of which we had none. Next slide, please. So we wanted to spend some time talking about themes, and you'll see later a link to the consensus comments in total and the master data set as it stands. But just from an informational perspective, some of the themes we saw in the comments were the need to add back the CPT and HCPCS for medical nutrition therapy. We got 7 requests for that. So because it's unique to the other interventions, we created a separate intervention section for that. We got multiple requests to update program definitions and to add missing program definitions on our program definitions tab on the Excel spreadsheet. That required a fair bit of back and forth with the submitters and the subject matter experts and other key content experts who've been helpful in previous elements of build. We're very grateful for all of that background work. And then we got some comments regarding our integration eventually into SNOMED CT, because there's some conflicts between definitions that we have and existing definitions in SNOMED CT. And there's some challenges to food insecurity's current place in the taxonomy of SNOMED now that we have our formal definitions very clearly established. So this will be work that we have to do going forward. Next slide, please. So again, these are the documents that are published as they stand. So the consensus approved food insecurity master list is at this link. And then the voting comments and dispositions, in which you can see every comment that was submitted and our adjudicated response, that is available as well. As a public community, everything is open and everything is available to all. Next slide, please. I'm now going to pass the torch briefly to Linda to talk about the gap analysis work that we've been doing with the ONC.
Thank you, Sarah. Yes, now once we finish the consensus reconciliation and we publish that master list, the master list then described for us all of the concepts for screening, diagnosis, goals, and interventions that were left after the complete adjudication and comments. So as you can see from this slide here, we actually received more than 400 requests from submissions for data elements. Now, a number of those ended up being duplicates where multiple organizations were using the same screening tool or they were using the same diagnoses. Others during adjudication ended up being determined to be out of scope or appropriate for a different domain. What we were left with on the final master list is 224 data elements. And you can see from the chart, the first column shows the total number of concepts by clinical activity area, And the middle column shows how many have a current code in one of the code sets or terminology that's appropriate for that activity. And the last one shows you which ones require codes. So this last column represents our gap in terms of codes being available for these concepts within those different activities and the supporting code sets terminologies. So this, when we talk about the coding gap analysis, this is the gap we're focusing on, is this last column. So we've actually identified the gaps in an internal gap analysis report. And because, you know, not every, we have to actually prioritize because we can't work on too many things at once, given the scope and the resources available. So the next level is to define a priority for the future work represented by these gaps, and we're actually working and have been working on that. And we will be looking at the best way to disseminate that information once we've concluded that gap priority statement that recognizes what activities need to be done to address the gaps, who needs to be involved in that, and what are the steps to actually achieve that. The gaps are also being addressed in the FIRE IG work. As part of the Connect-a-thon testing, we are looking at some of these concepts that are in either current codes or ones that require codes. We're looking at how those will work through that Connect-a-thon testing process. That may help us also refine some of these when that work is done before we actually submit them for new code requests or any revisions. And I believe, are there any questions on this? If not, then I do see something in a chat and want to recognize Lucy. Thank you so much for that comment. Yes, I think it was truly a community effort to get where we were with food insecurity and end up with having that list of concepts and identifying what we need to do next in terms of filling those gaps. If there are no other questions.
This is Art Davidson. I have a question. Can you hear me?
Yeah, sure.
Yeah, so could you go back to this prior slide, please?
Sure.
So on that last column there, you say there are 22 screeners and 71 questions. These are new concepts that have no codes from screening tools, or what? I don't understand how.
These are existing screening tools that, for whatever reason, have not been submitted yet to registries to be added to the LOINC code set. So when you look at the master list, if you go out to look at that, on the screening activity, you'll see the full list of them all, and you'll see which ones currently have LOINC codes assigned for the panels and the individual questions. But you will also see a fair number of those, actually 22 tools, that do not have that. So for purposes of interoperability, if we need to pass data back and forth for any of those screening tools, we need to get them into that standard code set.
So the definition of a required code is that it's in LOINC?
For screening, yes. LOINC is the recognized code system for screening tools, essentially assessments, yeah.
But you could generate a Z code from that, right? Or not?
No, in ICD-10, the Z codes really focus on more high level. They may identify that the patient has food insecurity, but as a diagnosis or a health status, but they wouldn't necessarily, the tool that would be used to identify how they derived at that would be one of these screening tools, which you really wouldn't be able to clearly identify in an ICD-10 code.
Thank you.
Anything else?
And Linda, I could just add for Art, there's a slide, Sarah will walk through a slide, and for the homework, we do have, Linda has already recorded a session initially explaining the different code systems and how they're used across the 4 activities. So please stay tuned for that, and or happy to send you that via email so you can get a sense of what codes are applicable to what activities.
Okay, thanks, Evelyn. I can turn it over to Mark now.
Yes. Mark, please go ahead.
Thanks, Linda. So good afternoon, and so happy to be serving on this team. The other day, Sarah and I were discussing the numerous stories about people misusing health data and whether the Gravity Project should actually have a statement or governing principle about data justice and using social determinants data for good and not misusing them. And I shared with her some coalition work I led in 2010, where a coalition of state and national organizations developed a set of consumer principles on electronic health information exchange in general, not just social determinants of health. And Sarah and I agreed that it would be good to share with all of you a quick overview of those principles and then ask you whether you think we should develop a comprehensive set of principles on data use and exchange, or just a focused principle or two on data justice and social determinants of health. Either way, today we're just asking the initial question of which direction we should take, and then we'll draft something and bring it back for discussion and consensus at a future meeting. So what you see here are the different principles that we came up with. It was a coalition of 23 consumer health and civil rights organizations, and they were from state and national across the country. And the principles covered, for example, improving individual health care and its quality, safety, and efficiency, improving health for communities and the public, ensuring that all patients and consumers benefit fully and equally, designing technology and services so that they meet the range of needs without barriers or diminished function for some. So, for example, people using languages other than English or people with disabilities. Privacy and security, ensuring that privacy and security of patients' health information. Preventing misuse of patients' data. Building partnership and digital health literacy among patients, providers, and public health officials. Accountability, holding providers and regulators accountable for realizing the benefits of health information exchange for all. And enforcing these principles and protections for patients and communities. And, you know, pretty simple up on the slide, but this was represented about 6 to 9 months of conversation and work. So next slide, please. So because privacy, security, and data stewardship are such hot topics, we also expanded on the privacy and security principle that I just mentioned. We borrowed from the fair information practice principles that have been around for some time to come up with these, that all data stewards should make their policies and practices open and transparent to patients and the public. Stewards should only collect data for specified purposes and, where possible, with the data subject's knowledge and consent. Stewards should specify the purpose in advance and collect only the data reasonably necessary for that purpose. Data should be accurate, complete, and current, and patients should be able to correct errors. Data should be used and exchanged only for the purposes specified, and data stewards should immediately notify data subjects of any breaches. Individuals have a right to a copy of their data and to challenge the collection and use of their data. And lastly, the data should remain in the control of the patient and providers directly involved in the individual's care. And if any of you are interested, this document should be up on the Gravity Confluence page shortly. Next slide, please. So with that as background, we just wanted to ask an initial question today. We know that the same health data can be used for good or harm. For example, it can be used to identify or redress health disparities or used to redline and profile. So we're thinking that we should add at least a governing principle on data justice and social determinants of health. But we're wondering what you think. Should we go further and draft a broader set of principles on data exchange and use? Perhaps something like what the example I just covered from 2010. So we put the question to you. What do you think?
Mark, this is Evelyn. We got a message from Jim. He's saying, pulling from medical ethics, is there a place in this list for patient autonomy in the use of their data, or collection or use of their data? Correction.
There is definitely a place because if whatever we do has not been drafted for everybody's good thinking and feedback yet, there is an autonomy principle in what we worked on in 2010, but that's just an example of what's possible. So the answer is yes, there is a place.
So there's a question on timing of feedback. So we're hoping to use this next month to solicit information, and it's the way to do so is in the homework section at the end of the presentation.
Hi, it's George Dixon. I would like to say yes. If you don't have the trust of your patients, they're not going to share their social determinants of health data with you in the first place. So this needs to be part of a patient's understanding.
Great. So that's a yes to a comprehensive set. Is that correct?
Yes, not just
Great.
specific
Thank
to
you
these,
so much.
but it is in general.
Yes,
For the sake of time, I'm seeing lots of amazing comments in the chat box as usual. I'm wondering if folks can take those key comments, and we always store all information that we get in the chat and the record, but if you can specifically draft an email, and then Mark and I are going to be the collector of information, and our emails are included at the end of the presentation. And please just send thoughts to us, and then we will collate them and then bring them back to the community when we next meet. Does that sound like a good step forward? Rich votes yes.
Sounds great to me.
I think we got him out, Sarah.
Okay. It's nice to be back with the family. I feel all right. So thank you for that reception, and it's nice to work with a group of people who, when you propose this kind of thing, they say absolutely yes, and then start telling you great ideas about how to make it better. So moving on. So, oh, sorry, you can stay here. So even though the housing instability and homelessness and housing domain doesn't formally kick off until the middle of March on the 19th after HIMSS, we really feel like it's important, from learning from past experience, to step forward on our housing foot well from the beginning. Next slide, please. So this is a table that those who've been involved in Gravity know well. So it's an ongoing table that includes data element submissions and then their evolution into adjudicated data with dispositions. So the top element of the table includes two different rows. So one of those rows is something I undertook myself, which is bringing over every comprehensive tool that was suggested in the food insecurity domain, such as the Everyone tool, or the Health Begins tool, or the North Carolina tool, or Prepare. And all of them basically, and just doing a categorical review for housing domain fit, and then bringing them in as existing submissions. And then reviewing also the Siren Compendium of Social and Medical Codes that we did in 2018, 2017. So that's the first row, basically things we already had, either from the food insecurity work or from the compendium. And then so far we've gotten 2 submissions already, 2 formal submissions. And again, this is through the process, which we'll describe in a second and demonstrate a slide of, which is either through an Excel spreadsheet that sorts things into the screening, goals, diagnoses, interventions, tabs, or through the data collection tool. And then as we go forward and the subject matter experts come on and adjudicate, you will see these move down into the bottom section of the table. Next slide, please. So this is a visual. I think that Lisa made this, as far as I remember. It really is a model of how this adjudication happens and how it evolves and turns into the master list and then the consensus list. So it starts on the left-hand side. So the whole community submits potential data elements. These are then adjudicated with concepts that we'll show you on the next slide. And then we work those adjudicated data elements into an ongoing master list that we collectively review as a community. We decide on this set, and then there's the final consensus review. Next slide, please. So I'm just going to take a moment to remind the community of the ways we adjudicate data elements. So the subject matter experts, Linda and myself, will either say that something's a duplicate, that it exists, but we're noting that it was submitted again. We'll say it needs to be added because it's in scope, but it's not there yet. Or we can say do not add, but park it because it's not in scope for this domain, but it may be useful for another gravity domain. This became a fairly robust section in the food and security work. There's a do not add adjudication also, which is not in scope for this domain or another gravity domain, and it's not fit for purpose. There's on hold, which happens often, which is that we need additional clarification from the submitter in order to properly adjudicate. And we do that via email or, if needed, phone calls. And then there was withdrawn, which is after discussion between the submitter and the subject matter experts, the concept was withdrawn by the submitter. Next slide, please. I'm now going to take a second just to remind folks again about how those activity tabs might correlate to the housing submissions. So what we ask for when it comes to data submissions are screening tools. Any standardized tool applies. So anything that has formal questions and formal answers. We're focusing initially out of the gate on housing instability and homelessness, but we welcome all screening tools that apply to anything regarding housing, including inadequate housing, because those might go into the parking lot. And really it's the role of the subject matter experts to sort these screening elements. So all housing screeners, please send our way. And the subject matter experts will take that initial concept match review and sort things and adjudicate them. We're also looking for concepts regarding goals of care. We're looking for concepts regarding needed assessments and diagnoses. And remember, these include things that need to be said but cannot currently be said. We know with existing code for homelessness, but there are other concepts that do not have diagnoses yet. And then the tab of interventions, which if you remember the food and security data set gets quite large. There will be some carryover of concepts from the food and security set, most notably around coordination, because those were concepts that were general. But we have some key asks for you from things that we learned the first time around. So please ensure that when you submit interventions, if it's a program, along with the program name, please include the definition, so that we can then educate the community about where it fits and understand how it conceptually fits with the rest of the data. Because if you remember in the food and security world, sometimes there were parent concepts that were general concepts, and then there were children codes that were related to the parent concept, but were required by the community, we felt, to name something specifically. So definitions will help us do that relationship sort with the concepts as they're submitted. We also hope to have you reference the interventions activities framework we made and suggest applicable intervention activities whenever you suggest an intervention. And to explain this, I'm going to go to the next slide. So this should be familiar. This is the intervention framework we worked on throughout the summer, last summer, and it includes our core interventions of referral, provision, counseling, education, assessment, evaluation of eligibility, assistance, and coordination. So again, when you submit data elements, please try to guide us as subject matter experts and the coding team to try to figure out where your intervention fits within this framework. Like, is it provision of a hotel voucher? Or is it evaluation of eligibility for federal housing program, which is incredibly general? But I think you understand that the hope is that we leverage what we already know and the framework we've made to make swift but thorough work of housing, because we have a short timeline. Next slide, please. So I have a specific question, a small working group asked regarding the homeless management information set. we've had multiple submissions for the HMIS 2020 data set. It is not crafted to be a screening tool or a tool used in healthcare settings. However, it contains a lot of information that we need to consider, and we need to figure out whether it's applicable or could be sorted into these screening goals, diagnoses, and intervention sections of our work, and if so, how. So what I'm hoping to do is form a small HMIS robust working group that specifically looks at the data set and tries to figure out how it could be sorted into healthcare terminology. Because remember, the activities, the tabs of screening, goals, diagnosis, and intervention all map to different standards of data standards. So we have to figure out where HMIS fits in that work. You're going to be specifically emailing me regarding this to be a little working group, and hopefully we can do that work, or at least accomplish some of it before we meet again in March. Next slide, please. This is how to review the Housing Instability Adjudicated Data Submissions Master List. It is very small now, but it will grow. Next slide, please. And then a break in that. And I'm going to actually ask, and there's not a question pause here, any questions regarding what I just presented?
Sarah, could you repeat? Can you hear me? This is Lucy.
Yeah.
Could you repeat what HMIS stands for, please?
Yeah, so the HMIS is, oh my gosh, I have to go to the Homeless Management Information System. Is that right?
Yes.
For all the folks who are housing people, it is a key.
Correct.
Yeah, correct. Say all the housing folks. My nerves got to me, so it was a little, yes. So Homeless Management Information System. It is a key HUD document for understanding how to help folks who have housing needs navigate to existing services. It is robust, it is standardized, it is the gold standard. However, it was not built to utilize in the healthcare setting, but we need to consider it because it's basically the HUD baseline. So,
so is this the framework that local governments use when they say we have so many homeless, so many inadequately housed? What is our need for affordable units? All of that. Is this what they use to come to those pronouncements and try to measure what the need is?
Yes.
Okay.
Who just said yes?
This is Gabe Kate.
Can you tell us where you're from?
Sure, I'm with a company called WellSky, and we provide the HMIS software platform for 60% of the continuums of care across the country.
So there you go.
I'd be happy to be part of the HMIS work group.
That sounds fantastic. Thank you so much.
Glad to be here.
Thank you both for explaining that.
You're welcome.
I think once you dive into the data, it will make sense about why we have to tackle this before we dive into all and figure out how to integrate it into all the other screeners, because it's massive. It's essential, but it wasn't built for this purpose. So we have to figure out how to utilize it in the healthcare setting and within our collaboration with community organizations and local governments.
Do we have any local government in the 110 participants participating today? Would that be helpful or
what
not necessarily?
So this is a perfect segue into the next section of the presentation.
Okay. Glad to help.
Yes. So this part of what we've been doing since we last saw you is work on the gap analysis and the consensus review. But part of it also has been taking a pause and trying to figure out really how to develop a robust structure that includes pointed insight from key stakeholders to make sure that we're not that we're integrating their insight from the beginning of the initiative. Next slide, please. So Gravity Project was originally developed as a limited term project focused mostly on data element identification. The effort has grown into a broader long-term project as an HL7 Fire Accelerator project. This requires a new governance structure that's under review that can ensure effective and agile decision-making that engages a broad set of stakeholders and sponsors and enables the project to succeed over a longer timeline. Some of that review is all about governance and strategy, and some of it is very practical. Next slide, please. So one of the things we've identified is in order to have the subject matter experts succeed in their work, there was a lot of background working group activities, and there were also times in the food and security data set development where we missed the voice of key stakeholders early in the initiative, and then they came in later, and there really were essential perspectives that we needed to have, and they revised some of the decisions we'd made prior. So our proposal is to build a technical and domain subject matter expertise panel called the Technical Advisory Committee that will offer insight onto the Gravity domain project teams. This will start with housing and then move on to transportation for 2020. Members are essentially responsible for getting feedback from their stakeholder groups on key questions and representing those perspectives. The TAC will include at least 2 representatives, but it can be quite robust. For each of these stakeholder groups, this includes patients and consumers, providers, payers, HIT vendors, community-based organizations, and federal government and local government. The committee is projected to meet bi-weekly or as needed, and I am the point of contact. Oh yeah, so Denny just commented, I think the TAC should also include SMEs from state and local government, and yes, that we did not include that, but that's 100% true. So if you have suggestions for this TAC, we already have some ongoing, please just send me an email. And again, it's so that we have these decisions, we have these decision makers and stakeholders right from the beginning to assist in the data set development so we can get a robust data set within the timeline that we need to. And we can anticipate not just the data, but implementation requirements like feasibility, practicality, and governance issues. Next slide, please. I'm going to pause again. So any questions on the TAC development? So
Sarah?
Yes.
I guess I would ask whether this is an HL7 requirement that you do this, or whether the team feels it would be beneficial to have interaction more frequently, much more frequently than you now have with this very large group.
I think I can say it's not an HL7 requirement, but part of what Gravity is open, right? So folks come and go, right? And so the idea of creating a TAC is that you would be asked to be present and there would be balance among stakeholders there. It doesn't in any way like displace the group of the grand collective, but it wasn't, and it was actually projected to try to alleviate some of the SME labor because just looking back on how many hours both the American Academy of Nutrition and Dietetics and myself had to put in to gather necessary information, not just from food and security experts, but from folks who had, when we community resource networks or different like government perspectives or food bank perspectives, for example. We felt like this TAC would just be a way to codify that representation from those different stakeholders was at least noted, so we can move forward swiftly with the work.
Thank you, Lucy. And Sarah, I'll just add that to Lucy's point, the overall governance is it is or encouragement, I would say more, from HL7 as a fire accelerator to establish the right structure to provide direction and guidance to the Gravity project. But as Sarah noted, this technical advisory committee is not common across the other fire accelerators. So it is unique to Gravity for that same reason, that we really need to be able to reach back to subject matter experts in the field who cannot always join our public calls, are busy on their own end, and we really need to give them targeted questions. So this creates a formal structure around it. And I do want to acknowledge there were questions. So Ruth noted in regards to the TAC, who will represent the research evaluation aspect of using the housing domain data. We did think about researchers, so I do want to acknowledge, and Caroline Finstenberg is not on, but when we initially looked at across our stakeholders, and Caroline is part of our Siren team, who are the overall founders of this project, and they care about the research aspect. They will, so just, I do want to acknowledge Siren's role in this. Will keep that research focus as well, but we thought our technical advisory committee should consist of entities that are on the ground collecting and using this data. But also Sarah herself is a researcher, so we will keep that broad aspect in mind. And I think we have
I guess the only...
And Sarah, Sarah, there was also a question from Jenny. This is Lynette, sorry. She's asking if there's a longer-term goal of aligning the HMIS with the consensus data elements identified through this initiative.
And I think that we can say yes. So that's one of the things that is, it's not necessarily in scope regarding Gravity work, but it is the goal of the ONC, basically, to have any standardized open data be interoperable and aligned with other standardized open interoperable data. So longer term goal, yes. In Gravity scope, perhaps not. But it's very similar, I think, to some of the work that we're trying to do with other community data sets that need to speak to healthcare data in order to be truly interoperable, like the AIRS taxonomy, for example. Like, if we're really going to be solving social needs, we have to be able to have healthcare data speak to community data. I definitely sit in the healthcare set, so I reveal my bias, but that would be the long-term goal in the long run, not necessarily in scope for Gravity, but definitely on the horizon. There's one other comment from Alexis DeRosier. Sorry if I pronounced her name wrong, but HMIS is utilized. I'm trying to figure out. Is utilized as part of the creation of estimates, but many communities also incorporate data from other sources. If any of that data collection beyond HMIS is standardized, we would also appreciate that as part of our submission, so we can have consensus of standardized collection tools. All right. Any other questions before we move on? Okay, so homework. There's a fair bit. So submit, well, the first goal is to submit housing instability data element concept. Oh, so Lynette, I think you're
nope, it's not me. Let me look in the list.
Somebody's typing.
Oh, sorry.
Yeah.
So
it's okay.
So
no worries. We all do it. If you don't mind hitting your mute button, thank you.
Similar to food insecurity, the first ask, and again, as a previous subject matter expert, I ask that we do this as early as we can. So April 3rd might be the deadline for when we submit data concepts, but the earlier you submit them, the more reasonable it is to do the adjudication. So similar to previous food insecurity data element submissions, please submit your concepts via the downloadable spreadsheet, the Excel spreadsheet you can find on the Confluence or the online web tool. For instructions, links, and downloads, you can always go to the Confluence. For questions on how to do this, you can always send an email to gravityproject@emiadvisors.net. for that HMIS work, please write Sarah if you're interested. I already have a few emails, which I love. And again, I'm a fish out of water with the HUD data, so I look forward to your assistance, as you can tell. And then regarding data justice and data principles, please review the example of the principles Mark spoke to. They will be posted on the Confluence for your review. And then you can write Mark and Sarah with thoughts, and then our emails are there. And they will also be available on the Confluence. Next slide, please. There was a reference to this earlier in the presentation. We do understand that because there's a vast subject matter expertise in the community, maybe the coding systems are not front and forward, and that's actually our job to try to do that matching. But there is education on the Confluence regarding those coding systems. We've spoken about them and how they correlate to the activities of screening, goals, diagnosis, and intervention. There's a brief overview that Linda was really helpful to create, and you can find that on the Confluence. Next slide, please. All right, any questions? We have gotten through a lot of information in a very short period of time.
Sarah, I would just comment that one of the things that I found refreshing and stimulating about the work that we did for food insecurity was that there really was a very strong focus on coming out with something very specific and usable to improve healthcare and record health information exchange. For housing, we seem to be attempting to meld a very long-term and long-time sector of measurement and action and evaluation with a record system that didn't know anything about it before we're going to talk about it. So I would just express the hope that for all of the principles and governance and strategic discussion that we have, that you, the team, really press us to get very specific ultimately about what it is we want to measure and how that's going to be done.
Thank you for that comment, Lucy. And I'm sorry if I would say actually the goal is still specific, right?
Okay.
100%, right? Because it has to, we speak from the healthcare perspective, but we're trying to wrap ourselves around things that the community has known about and assessed for a long time, right? So the HMIS ask is really because we would be negligent to not consider how those data elements that have been existed and been utilized by communities and by HUD could match or be integrated into existing healthcare approaches. Our existing submissions are still tools that are utilized in clinical settings right now, right? So their Prepare tool, the Accountable Health Communities tool again, the Everyone tool from the American Academy of Family Physicians, and then like this lovely gold standard Children's Health Watch, again, Housing Instability, Vital Sign. So those tools are the things we have. But because we've had multiple submissions, multiple emails basically asking us to consider HMIS, I'm compelled to make sure that we do that well, right? And we all are compelled to make sure we do that well. So there's this working group off on the side that will grapple with that.
So this is really a cutting edge project in that respect. Thank you.
Any other questions?
Sarah, there's a comment on AIR's taxonomy.
Oh, yes. Mapping AIR's taxonomy. So yeah, we've had lots of wonderful conversations regarding this need. It's funny, even though it's been quiet on the public front, so far, the things that we've done since December are the consensus review, governance structure, gap analysis, discussions about mapping to community settings. There's been so many things in the background. So just know that we understand that requirement and are really trying to make sure that we anticipate ways to do that well. So thank you for that comment. On to next steps, I think, unless there's any other questions. I believe next steps is back to Lynette, or is that true?
Yes, ma'am. I believe so. I just want to take a moment to acknowledge my wonderful and amazing team. We did get through a lot today, and I'm sure all of you listening your brains are probably full. So if you go away and you think about anything that you would like to ask us or to follow up with us on, please do email us. Our email addresses are all over this presentation. I also included in the chat Mark and Sarah's email addresses earlier, so you can capture those while we still sit here on the line. Next steps, obviously, we would love for you all, or as many of you as possible, to submit housing instability data elements. We have a tight deadline. Obviously, you saw the timeline earlier, so we're trying to move as quickly as we can. And to Lucy's point, this is a lot of work. This is major. We are changing the way things happen. And we acknowledge that time is limited. It doesn't make this any less important. So we are going to look to all of you for your focus and your feedback as often as possible. So please feel free to keep lines open, communication lines open with us. We are always happy to hear from you. If you want to test the food insecurity data set through a Connect-a-thon, please do sign up for Connect-a-thon testing. You can find the link on our Confluence. It's also here in this deck to sign up for that. If you want to visit us at HIMSS in Orlando in sunny Florida, we would love to see you there as well. And then if you have not already done so and you would like to be included on our email distribution list and receive updated meeting invitations, etc., please join the Gravity Project as either a committed member or another interested party. Next slide, please. And I believe that is all. Do we have any other questions? We have a couple of minutes before the top of the hour. Does anyone have any last thoughts or questions?
This is Sarah. I just
Okay.
want to say we missed you. Yeah, no, this is just one of closing thoughts. We missed you and we're glad to be back. So thanks for the collective is good and we look forward to the future work.
Yes.
Thanks, Sarah.
All right. Thank you all. Oh, go ahead, Evelyn.
Because our leader, technical director, is not on the call, I do just also want to emphasize on the Connect-a-thon testing. This is to support the fire ID development, which is very important. We are a fire accelerator for this work, and of course, being able to support the interoperable data capture and exchange. Please note that the May Connect-a-thon is focused on use case 1 and use case 2 testing, which is, again, very important. We have 3 use cases, but we're focused on the first 2 to begin with to meet the September deadline. So please do sign up for those that are interested in supporting and evaluating, validating our fire work.
Yes, and this is Lynette. Again, one last thing, we will distribute a community email early next week, so check your inboxes for that. If you have not ever received email from us, please do go on Confluence and sign up as a registered member so that we can share with you. And unless there's anything else, we will go ahead and adjourn our first meeting of 2020, and we will see you all on March 19th for the housing domain kickoff.
Great, thank you.
Thanks. Thank you.
Thanks
so much.
to all.
Okay.